Hey family, Judy Jones back with better tips for you. You've been diagnosed with HPV. Now what are you going to do? The first thing you're not going to do is panic. The second thing you're going to do is get yourself to an urgent care clinic provider or your regular primary care provider to maintain counseling and begin treatment. Thirdly, if possible, you're going to contact your partner or partners, informing them of your recent condition. Now let's get down to the nuts and bolts. What is HPV? HPV, or the human papilloma virus, is a group of viruses that can cause warts and other health conditions. One reason I am focusing on it and speaking to you about it, even though one of my colleagues recently told me she hasn't seen much warts in her practice as a women's health nurse practitioner, HPV is the most common viral sexually transmitted disease with over 6 million Americans affected yearly. There are over 200 types of HPV ranging from low to high risk. How did you get it? HPV is spread through close skin-to-skin contact, usually through sexual activity. The risk of infection increases with the number of partners. But you can become infected with the virus without sexual activity. If you are in prolonged contact with an infected skin, holding hands for instance, the virus can be transmitted. How is it diagnosed? HPV is usually diagnosed with an HPV test, or an abnormal pap test can signal trouble. A test looks for HPV DNA in cervical cells. The test can be performed alone or in conjunction with a pap test. If you go to the clinic and are simply asking for an STD test, an HPV swab would be included. But if the swab results positive, then the provider will strongly suggest a pap smear. Of course, this is for the women. Please note, there is no general test for men or women to check HPV. And currently, there is no approved test to rule out HPV in the mouth, the throat, or genitals. How's it treated? While there is no cure for HPV, the body's immune system usually clears most infections within a few months or years. Another reason why you should treat your body with respect, giving it good food, lots of water, moderate exercise, and rest, to include sleep. While no cure exists, there are treatments for the health problems HPV causes. Genital warts can be treated with medicated creams, freezing the warts with liquid nitrogen, or surgery. But the warts may return after a few weeks, requiring more treatment. If abnormal cervical cells are resulted, cryotherapy or freezing them can be done. Tip number 1. The HPV vaccine is safe and effective, offering mild after effects to include inflammation or soreness at the injection site, with possible fainting or dizziness once the injection is given. For this, we usually ask the patient to remain seated for approximately 15 minutes after the injection to monitor this. The CDC recommends the vaccine be given to patients ages 9 through 26 to reduce the risk of HPV-related cancers later in life. However, those 27 to 45 may consider getting the injection if they weren't vaccinated when they were younger. For more information on the vaccine, please check the information in my description box below. Tip number 2. HPV causes head and neck cancers too, with the virus spreading to the throat due to oral sex. According to Cornelia Lou Trimble, director of Johns Hopkins Center for Cervical Dysplasia, the rate of cancers in the back of the throat is skyrocketing. Some experts are using the word epidemic. And lastly, tip number 3. According to Dr. Trimble, while women can get the associated HPV-related cancers, most of the people who get them are heterosexual males. All the more reason for the boys to be vaccinated as well. Please like, subscribe, and comment on this video. And please, be careful.